but the research has revealed that we're not sure if it's a psychological, we're not sure if they're doing it because they need that element that's in the stones, or are they eating the stones and it's causing a deficit. So these are just theories. So under your nursing considerations, you're going to be, of course, doing a really good H&P. And are they having a lot of pain? Anemia, because they're not taking in nutrition, they're taking in non-nutritive substances, they're usually anemic. And then developmentally, are they getting behind because they aren't getting the right nutrition? One of the problems that has been a recent one in the last 6 months because of the coronavirus, children have been drinking the hand soap, hand sanitizer. And that's bad enough, but a lot of the hand sanitizers were taken from countries that didn't have precautions, and they were actually putting poisons in it, not intentionally, but they were putting poisons in it, and children were dying from that. So we've got to be careful with our poisons. Ingestion of foreign bodies. They put everything in the mouth. And I used to have slides that showed the different, SpongeBob toy, all kinds of stuff. If you work in an ER, you could tell us a billion stories of things you found in a child. So it is the leading cause of accidental death, this is on page 842, of children less than 4 years of age. The problem is children have small esophagus. So they swallow something that to adult we could get down, but they can't, and it gets stuck. So some of the more common are peanuts, seeds, nuts, hot dogs, vegetables, great big ones, broccoli that's not cut up small enough, carrots, metal or plastic objects, and bones, other frequently aspirated items. So the problem is it can cut off the airway. They get it so far, they can't get it any further. And it can cause a perforation in your esophagus. That's serious trouble. Acid burns, because they're batteries and things like that. We're going to talk about that in a minute. And esophageal erosion. So what you're commonly going to see, a lot of times they're asymptomatic, you don't even know. And then they pass it in their stool later on. But if they are symptomatic, they're going to be choking. Depends upon where on the body it's stuck. So they could be choking, coughing. Maybe they can still get air through, so they're wheezing, drooling. So under diagnostic evaluation, I want you to remember that we're going to treat the child first before we do anything else. If that child comes in and they're not breathing, we're not going to stop and get an x-ray. We're going to do something. We're going to get that child breathing first. And then we're going to get those diagnostic tools. So you're going to want to listen to the lungs. So if he comes in, the mom says he's just not been able to eat much lately, but he's still sitting there, he's pink. You're going to listen to him to see if you can figure out there's a wheezing going on. Maybe it's only on one side, not the other. So you're going to do your nursing assessment. Usually an x-ray will help. Endoscopy for further obstruction will help us pinpoint where it is, so then we can go in and get it out if it needs to be taken out. So this says, when are you supposed to intervene to retrieve a foreign body? This is on page 843. If there's an airway obstruction, yes. If they're symptomatic that way, yes, you're going to take it out. Magnets, they do bad things, because if they swallow a magnet and then they have another magnet, they swallow two magnets and they get separated. One can be in one part of the intestine, another can be in the other part of the intestine, and all of a sudden they're stuck together. and they got a bowel obstruction. So yeah, we want to try to get magnets out. Batteries erode, so they got that poison can go in them. Sharp objects. I had a friend whose child swallowed a popsicle stick whole. And she was just like, oh my gosh, so she had to take him to the hospital just to get that. I don't know what they ended up doing, but yeah. So we take them out if it's causing an obstruction or it's one of these deadly things, but we're gonna try to figure out where it's at first. We wanna make sure that if it's a magnet, where is it at, so we know how to go. Are we gonna have to go in laparoscopically? Are we gonna have to go in via the mouth? What are we gonna do? So, and when to avoid intervention for retrieval of a foreign body, a lot of the times if the child is just walking around, they're doing fine, you can let it pass. They swallowed mama's wedding ring, you're just gonna make sure you keep the diapers and go through it to make sure that you can find it again. So most of the time we want it to pass, and it should pass in 24 hours. Your book says we really don't want anything in the esophagus longer than 48 hours because it can cause some erosion in the esophagus. Okay, so you're going to be doing some family teaching. I always think that's just a little bit cruel. I mean, already the mom's upset because this happened, and then we're telling her, hey, don't leave stuff around. Well, sometimes children find things, but we are going to continue to instruct. We are going to do it, we'll just do it in a gentle manner. Make sure anything small or poisonous is kept out of reach. I had 3 brothers, and all 3 of them at one point in their life ate rat poison. You know, I never did, but I was the good child. Treatment guidelines and education and support. On page 844 is a good little box. I'm gonna look at it and see why I wrote that on there. Oh yeah, emergency treatment on page 844 is a good little box to know. Hint, hint. Okay. Decide where I want to go on and when to go away. These next few will not take very long. Can you hang with me for a couple more minutes and then we'll break? Okay. I put times on my slides and we are actually right, perfectly on time. So on pages 263 and 264, this is hypoglycemia. This is talking about an infant with hypoglycemia, not someone who is being treated for diabetes. So just get that in your head. If a baby is large, they've been eating a lot, they're like 10 pounds, they've gotten used to a certain amount of blood sugar in their blood, and they get born, and suddenly that sugar is cut off, they drop. Their blood sugars go down to 30, 20, and then they're jittery. Small babies, they don't have enough stores, and they can drop their blood sugars. Intrauterine growth retardation, again, it's another form of a small baby. Infants of diabetic mothers, here's the interesting thing about that. If the mom has diabetes, the baby, starts making the insulin in its body because of the high blood, if her blood sugars are out of control, it starts making insulin while he's in the womb. So when he's born, he's got insulin but not enough sugar, and his blood sugars can drop. So these are babies that can have an issue. There's no clear guidelines. The American Pediatric Society on page 263 says you should feed the baby, test their blood sugar. If it's less than 25 after so much, then you test them again. So our criteria is anywhere less than 30 or 30 that we go ahead and check their blood sugar and feed them. That is the answer. We feed them, okay? Feed the baby. If the baby can't eat, if they can't, if it's got issues where they cannot, sometimes swallow and breathe takes an awful lot of coordination and it takes a lot of calories. Sometimes they wear out on you, so you might have to put an NG tube down them and feed them that way. But we want to feed the baby. That's our first protocol. Around 30 and less, yeah. And the symptoms for a baby are so subtle. They're just a little bit jittery, just a little bit. They have a little bit of a tremor, or they get real lethargic, or they suddenly start crying. I mean, they're just real subtle. So at our hospital in Ponca City, we check every baby's blood sugar once. I think it's 2 hours after birth. We check it and make sure that it's doing okay. And then if the baby's stable, we take them out to mama so they can be fed. There are some, just know this in the back of your head, if their blood sugar is still staying low, you can give them sugar water. You can hook them up to D5W. In that case, we want to put them in a unit where they can be watched more closely. So just know that there are times when you have to intervene, and feeding doesn't help. Okay, so hyperglycemia, transient, again as babies. Usually the babies that are getting D5W, they're low birth weight, they're giving them some dextrose in their IV, and they're not tolerating it. You're going to be doing blood glucose monitoring, your finger sticks or heel sticks, and monitoring their output. Make sure you're keeping there's no glucose in the urine, and support the parents. Okay, hemorrhagic disease is our last one before break. Page 265. This is why we give them vitamin K. And why do you need to know this? Because NCLEX is global, and not everywhere around the world do they give vitamin K. And some places, even in the United States, the moms don't want the baby to have vitamin K for whatever reason. And they can start bleeding. They start bleeding around any of the areas that you would expect around their umbilical cord. They can have oozing. They can have oozing around a circumcision if they were done that way. They can have it in their urine, in their stool. So they just start bleeding. What are you going to do? Give them vitamin K. That's the bottom line.
Does every baby get vitamin K?
Yes. When they're born, they all get vitamin K. They don't have the food in their stomach to promote the starting of the processing of the vitamin K, so we give them a little help.
Unless it's refused, correct?
Yeah, that's it. All right, let's take a break. Meet back here at 10.